Hi, my name is Katrina Keefer. I'm the Chief Executive Officer of Augusta University Health System and Executive Vice President for Health Affairs for Augusta University. I welcome you to Facebook Live today and to Instagram. This is the first time I've done this, so I hope that you will be patient with me. I'm joined today by the Augusta University Health System Chief Medical Officer, Dr. Phillip Coule. Dr. Coule has been very front and center in many of these issues for us here at Augusta University, and so I appreciate his joining me today, or letting me join him. We are sitting a little close together, Dr. Coule. I'm not sure if we should social distance a little further, but it really is a pleasure to be here today. I want to start by expressing my gratitude and admiration to the entire Augusta University Health family, the community of all of our caregivers. Our teams have really been working tirelessly to concurrently care for our existing patients as we prepare for those presenting with the COVID-19 symptoms. This is truly an unprecedented event which continues to evolve daily. For us, there's no slowing down. Our community should feel rest assured knowing that here in Augusta we have some of the best healthcare expertise and providers in the nation. And our health system strives to be innovative and nimble. One example of that technology is that we expected to deploy technology to our employees beginning of April that would have them to have virtual care visits with our caregivers and our physicians, our advanced practitioners. Instead of that, we were able to quickly, understanding that COVID-19 was coming and we needed to keep patients out of our emergency departments, we were able to shift and deploy technology and adjust for an online virtual screening utilizing that technology. This does limit the traffic in our emergency departments and eliminates risk of infection to other patients and caregivers. We're pleased to offer this service to our community free of charge, and we encourage you to go to augustahealth.org/COVID-19 and download the app. And if you're having any symptoms, this would be a great way for you to have a virtual visit with one of our experts free of charge. Individuals whose virtual visit results that they need to be screened for influenza or respiratory infection or COVID-19 will be directed by that provider. Through today, the specimen collection sites have been outside of our emergency department to the extent that it was available for our patients. But today, we're announcing that effective tomorrow, we will be moving the specimen collection to Christenberry Field. This service will only be offered to scheduled patients resulting from a virtual visit or a visit to our hotline. This approach is intended to honor social distancing precautions and not require anyone that may be infected to even leave their vehicle. On the main hospital campus, we've also taken steps to protect our employees and our patients and our visitors. Currently, we've limited access to the hospital by closing several entrances and screening guests at the door for symptoms related to COVID-19. We've also strengthened our modified family presence, so no children under the age of 18 or people with respiratory illness will be allowed into the hospital, other than those, of course, that are receiving direct patient care. While our ambulatory clinics remain open and our elective surgeries do continue, we're evaluating the situation each morning to make decisions for the following day. We request your patience from our patient population and appreciate your endurance in enduring any inconvenience that this may cause. My ask of you is that you remain calm and put your trust in the healthcare expertise of the state's only public academic medical center and the physicians at the Medical College of Georgia. I appreciate the support of our community and the media and look forward to sharing more in the coming days and weeks about what we're continuing to do to respond to COVID-19 to protect our patients, our caregivers, and our community. I'd now like to turn it over to Dr. Coule and let him bring some remarks.
Thank you, Katrina. I think it's very important for us to understand that we're very fortunate here to be an academic medical center, and because of that, we've been able to get results back from tests much quicker than we would have otherwise. So because of that, we are able to have a shorter turnaround time on some of these tests, particularly for those that may present more risk than others. We are using a screening protocol that involves exploring alternative diagnoses. So we do what's called a respiratory pathogens panel, which looks for things like influenza or other viruses that are identifiable, and then therefore only progress to testing for COVID-19 for patients that are negative on that panel as having an alternative diagnosis. So we have screened many people with the respiratory pathogens panel, but in addition to that, we have tested 65 patients for COVID-19. Of those, as of today, 3 are presumptive positive. 2 of those remain in a status of what we call indeterminate, meaning that we are awaiting the final determination on that test and do not know the results of those yet. It's going to require further testing. Additionally, we have 32 that are presumptive negatives, and actually a combination of negatives and presumptive negatives, which leaves 28 tests that are currently pending. We'll be running more tests today in order to determine some additional testing that will be done here. But in addition to that, we are sending some of those out, particularly lower risk cases. We'll be sending those out to an outside facility. We have really been able to ramp up our testing and our screening. It's very important that we, as we do our testing, that we that currently we have no positive patients in-house in the hospital. Every patient that is in the hospital that we have tested actually has been negative, and we still have none in that case now, and those are being on isolation at home. For those that do test positive, it's important to remember that 80% of those that do have this virus will be with minimal to no symptoms at all and have a very minimal course. It's also important for those who have been notified that they've had contact with someone who is an identified case and they've been asked to quarantine, that they honor that quarantine and remain at home and not out in the public. And particularly for those that are ill for any reason, that have cold or flu symptoms, to not go out into the public and to seek screening via the methods that we've described. For those that do have to seek care, it's important that people notify their healthcare provider, or better yet, call our COVID-19 hotline to get screening and to notify, and not just show up in an emergency department seeking care, whether that's at our facility or others. That runs the risk of exposing others. So we would prefer that people download the app and that they receive their screening online in order to determine whether or not they need to progress to testing. Again, for presumptive positive cases, we continue to do trace contacts here at Augusta University to identify any that may be at risk and need to be notified about that, and we're continuing to do that. Again, it's important to emphasize that there are currently no patients at Augusta University in the hospital that have tested presumptive positive at this time. It's also important to understand that persons that are quarantined that may have been exposed to someone do not pose additional risk to others. A common question that comes up is, well, this person's on quarantine, so do I have to be on quarantine? And the answer to that question is no. So when a person is identified that has COVID-19 or is suspected of having COVID-19, that person, if they're ill, goes on isolation, then their surrounding contacts go on quarantine. Their known immediate contacts go on quarantine. But that doesn't continue to progress, and you don't quarantine those that are exposed to those that are notified they're on quarantine. Again, quarantine is simply the process of those that may have been exposed to reduce exposure to remain at home for the 14-day period. It's also important that people remember the aspects of social distancing. Social distancing is not gathering together in large groups, particularly where there are vulnerable populations like the elderly. The CDC has said that gatherings of 10 or more should really be discouraged, and particularly our houses of worship are at risk because of the concentration often of elderly people that are at risk from this disease. Here at Augusta University, we are practicing social distancing, and that includes conducting meetings online and avoiding large meetings and using media like this, where we're leveraging the internet to practice social distancing. And again, back to some of the basics. The same way that you prevent COVID-19 is the same way that you prevent the common cold or the flu. And that is good cough and sneeze etiquette, washing your hands frequently, using alcohol-based hand sanitizers, and again, those methods of social distancing, quarantine, and isolation. It's also important that you make sure that you're looking to trusted sources for information. Be careful about some of the stuff that is out there. You can refer to our website, and we've got a lot of information that are there. It's on the website, and more information will be coming.
Thank you, Dr. Coule.